In this EDC video, I'm going to go over a first aid kit. Now this is a very extensive, very capable first aid kit. It's probably pushing the boundary of EDC in terms of size. I usually have this in my computer backpack, so anytime I'm going anywhere with my computer with me, this would be with me. I have similar versions of this that I would bring in a backpack if I was hiking somewhere. If you look at first aid, there's sort of different classes to it, right? I'm actually, or I was for quite some time, a certified wilderness first responder. I let that lapse over the pandemic. So I'm not currently certified, but I have been through quite a bit of training in this. And you've kind of got your everyday cuts and scrapes, what somebody would call a boo-boo kit. On the other end of the spectrum, you have, major trauma. You're in a car accident, you've been shot, those sorts of things. And then there's a kind of a middle ground, which is, more serious cuts, orthopedic injuries, sprain your ankle, break your arm, those kinds of things. This kit, it covers the boo-boo kit, it covers the trauma, it's got some of the in-between stuff, all in this form factor that, you can, like I say, this fits in my computer backpack and I take it with me everywhere. And when I go on business trips, it goes on the plane with me. If I was in a plane crash and I survived the plane crash, but I had some sort of serious traumatic injury or somebody around me did, this kit is a very capable kit. This is an Orca. This is an Orca First Aid Bag. Couple of things that I've done to this. So this bag comes with a Velcro panel on the back here that attaches to a MOLLE panel. It's very heavy. And I leave this in my backpack. It sits in the backpack, so I don't need that. So I cut that off. And there's some other stuff that I had my wife do to this. I'll show you inside. It's got a nice carry loop, so if you're running somewhere with it, I can pull it out of my backpack, I can grab it, I can carry it with me. You'll notice on the outside here, what I have here, this Velcro strap is holding on a cat tourniquet. All right, this is like the standard in tourniquets. And the reason that this is so well regarded as a tourniquet is you can put this on with one hand. So say your left arm is severely damaged in an injury, you have arterial bleeding, you're bleeding to death, you can pull this tourniquet out, and with your right arm, you can put it on your left arm without anybody helping you and tighten down and stop the bleeding. So any kind of really serious extremity bleeding, a tourniquet is the treatment of choice these days. And so this is on the outside of this pack where I can very quickly get to it. Because when you need a tourniquet, you need it right away, right? You're bleeding to death, you're going to bleed to death maybe in minutes. You need to get to it quickly. I don't really worry about it falling off or going anywhere because, again, this is typically going to sit in my backpack. So I'll put that off to the side. And let's go ahead and open this up and get into the pack itself. So one of the things I did was I had my wife sew a little bit more organization here. I think this loop and this loop were bigger. I had her sew these down. And then this opens up. So we'll start on the top here. We'll work our way through it. Set of trauma shears if you need to, cut away somebody's clothing in order to render first aid. I can tell you I fly with this thing on airplanes all the time. I have never even had them ask me to take this out for them to check. So these shears have never been a problem going through security. And surely they've seen them on the scanners over and over at this point. So that's never been a problem. Got a little bag here, hazardous waste bag. If you render first aid to somebody, you're liable to have a bunch of bloody, gauze pads and things like the Band-Aids left over. So this, you can pack it up in this to dispose of. A little bit of rolled up sterile gauze. If you had a injury that wasn't a huge, super traumatic injury, this is a serious trauma dressing over here. You'll see some other stuff in here for major trauma. This is kind of a mid-ground kind of thing. Or even later on when things weren't bleeding that much, if you needed to rebandage something, it gives you a little capability there. This is a digital thermometer. And I'll show you when we get into the end down here, I have covers for this. This is one of these things that, you know, I wouldn't normally put a thermometer necessarily in a first aid kit per se, but I take this kit with me when I travel on business. If I'm on business travel and I don't feel well, if I wanted to take my temperature, I like having a thermometer with me. So there's some part of this which is keep you comfortable on your business trip kind of thing. Also in here, I've got a Sharpie. There's two reasons to have this in here, and this actually has a fine point end and it has a coarser end. So the fine point end is to fill out the soap note, and I'll show you the soap note in a minute. One of the things I see, it's kind of a pet peeve of mine in a lot of first aid kits, is they don't have a soap note. If you render first aid to somebody, you should be documenting what you're doing to protect yourself and also to document their care for whoever you hand them off to. So the fine end of this, you can fill out the soap note. The coarse end of this, I would use if I put a tourniquet on somebody, say I put it on their arm or their leg, and then you put a blanket over them to keep them from going into shock. You know, you write on their forehead, TQ, you know, left arm, when you put it on, so that when they get to the hospital, the people at the hospital know they've got a tourniquet on them and they better pay attention to that because, you know, you don't want to leave the tourniquet on too long. Up here, I've got a little Velcro loop just holding this, some medical tape. These are some wound closure strips. You know, if somebody's got a deep cut, you can use this to close it up. Some sterile gauze for bandaging. And this is the soap note. Now, you can download this form from my website. And there'll be a link. In fact, there'll be a link to everything that's in this kit in the description of the video. And this soap note, I designed this when I did my wilderness first responder training, working with all of my classmates. And we iterated this, you know, the wilderness first responder training was 11 days. You know, it was like 10-hour days. You know, we iterated this as we went through it. And this has everything you need in the sections with, you know, some extra information here. Like, you know, as you go through this, the first thing you do is scene safety. Is it okay? Is it safe to approach the person who's injured? Introduction and consent, body substance isolation. Then you do airway, breathing, circulation. It leads you through everything you need to do in order. It's got some extra information here for, like, how do you describe pain? It's got room here for vitals. It's got some diagrams of the person's, you know, front and back of their body, and you can mock up, you know, burns or injuries or where they are, how to clear a spine. And this is double-sided. There's two sets of these here. These are printed on Write in the Rain paper, is the way that I did it. But this form, you can download it off my website. You can print it out for yourself. A couple of Adaptec dressings if somebody has a burn. You know, you can use these, put it on, and then put gauze over this, and it'll keep the gauze from sticking. And then this is Velcro here. We open this up in the back. A bunch more supplies in the back here. Got some quick clot. This will help stop severe bleeding. If somebody's injury is not in an extremity, if it's a junctional wound, which is, you know, kind of where your arm meets your body, so like your armpit, you know, your groin where your legs meet your body. If you have an injury there, or you have an injury in the torso, you can't put a tourniquet on that, so you pack it. And if this quick clot gauze has an hemostatic agent that will help stop bleeding. This is a little cheat card that I made. It's like how to do wound stabilization, you know, direct pressure. Is it, you know, is it minor? Then you just do direct pressure. Is it a chest wound that's sucking or bubbling? You use a chest seal. If it's a serious, serious bleed, if you're getting a lot of blood flow, If it's an arm or leg, use a tourniquet. If it's a torso or a head or junctional, then you're going to pack it. So this is just a quick little cheat card for that. This is a big, just a big Band-Aid. This is a nasal pharyngeal airway. This is pre-lubricated. And, if somebody is unconscious, you just stick this into their nose and it will help keep their airway open. Not hard to use. All this stuff in this kit, you shouldn't use it if you don't know how. Get the appropriate training, but that's not very hard to use. This is something called a zip stitch. You put this basically on both sides of a deep cut and you pull and it closes the wound and kind of zips it up. You want to be careful. If you use this, you want to make sure the wound is really clean. But if you're in a situation where you have a deep cut on your leg and you're out in the woods and you need to hike out, you might want to do this so that you can hike out without, continually bleeding. And then these are hyphen chest seals, and there's 2 of them. You should always have 2 because you want one, if you have a wound that goes through, you want one for the entry wound and one for the exit wound. And these have a vent on them so that air can come out but not go in. Because if you puncture the chest cavity and you make an air leak into the chest cavity, a person's lungs will collapse and they can't inflate, because the way lungs are inflated is by creating a vacuum between the ribs, the chest cavity wall, and the inner sac of the lungs. So this lets you seal that up, and the lung should reinflate. This is one of the best, most versatile first aid items there is. This is just some compressed gauze. It's just a big long roll of it. Wrap this around an injury, pack a junctional wound, a lot of different things that you can do with this. If you have to do CPR, this is a one-way valve. You put this in the person's mouth. You can breathe into this and it will protect you as you do rescue breathing for the person. If you don't have one of these, and in fact, it's become, there's been a big change in thinking about this. If you're doing CPR on somebody these days, if you don't have something to allow you to do this, you just don't rescue breathe for them. You just do CPR without breathing. And that's, considered to be enough in most cases. But it's, if you can rescue breathe for them too, it's better. And that will protect you. Got some gloves here, multiple pairs of gloves. If I'm on a business trip and I twist my ankle, I can wrap my ankle up. You can also use this with the gauze that we pulled out before to make a compression wound or a compression dressing. This is a trauma dressing, and a trauma dressing is basically one of these with a gauze pad sewn to it. But this gives you, between this and the gauze, which we took out before, which is over here, you have the ability to create 2 trauma dressings. If you just twist your ankle, you don't want to use your really nice trauma dressing. This is North American Rescue. These are really great. It's vacuum sealed, so it's going to stay sterile. And you see here these red markings. That's where you rip this open. So in an emergency, under a lot of stress, you're not going to be like floundering around trying to figure out how to open the damn package, right? It's really well marked for you. Now I'm going to turn this and get to this end, which sort of folded out. And this is kind of the boo-boo kit, more minor kind of stuff. So what we have right here is some moleskin, some Band-Aids, just regular Band-Aids. These are the covers for the thermometer. That's an extra battery for the thermometer. So this is, kind of your boo-boo kit, and then the things to use the thermometer. This is, kind of wound care stuff. This is some lubricant for the nasopharyngeal airway. I think the one that I have in here actually is pre-lubricated. But you would use that with that. Some burn gel, there's some antibiotic ointment, some wound cleaning ointment here, or wound cleaning with povidone iodine, all in there. And then this is a dental kit. It's got some temporary filling material. It's got some, it's got some little gauze pieces. It's got little tweezers for putting it in. And this is I think, clove oil, which helps to deal with the toothache. So, if you're somewhere and you break a tooth until you can get to the dentist, this lets you do that. What is not in here right now and should be is a small med pack, and I think I took it out the other day because I'm checking the meds to make sure they haven't expired. I do keep this in my computer backpack, which has a pretty extensive med pack in it by itself, but normally in this there should be a little bag like this. It would have a couple of doses of Advil, some extra strength Tylenol. In case you don't know, Tylenol and Advil have different actions, and so you can actually, if you have really severe pain, you can actually take them together. That's a wilderness first aid trick. Normally I would have Imodium in here for diarrhea, some Benadryl for allergic issues, things like that. So that should be in here, would normally be in here. And so that's the basic kit. Again, it's pretty big. Certainly, depending on what you're doing, you could carry something smaller than this. But again, for me, it fits in my computer backpack, and I can go on a business trip and I can be comfortable that I have what I need for my own comfort on the business trip. And I also have, if something happens on the plane, it's probably going to be pretty bad. So I've got trauma capabilities. If I'm in a car accident, I have trauma capabilities. I have minor boo-boo kit kind of stuff. If I twist my ankle, I've got a elastic bandage. If I break a tooth and I don't want to go try to find a dentist in another country or another state, I have capabilities there. So it really covers a lot of ground. If you like this video, please like and subscribe. This is, I think, my 5th EDC video now. So, lots of content on that. And thank you.